Hi, it's Felicity here from Banchory Spinal Health, and these are my 4 things that you need to know before you bring your baby along to baby clinic. So we get asked a lot of the same sort of questions, so I'm hoping that this video will answer some of those questions for any of you who are considering giving us a visit for our baby clinic. So the infant clinic runs on a Tuesday morning from 10 till 12. And it's very busy. We see lots and lots of babies, and I just wanted to cover the most common things that we get asked. So number 1, I want to talk about eyeball pressure. So a lot of people associate chiropractors and osteopaths with that cracking noise, and a lot of people feel that we use a lot of force on adult bodies, and sometimes that's true, but what we absolutely never do is we never use that amount of force on an infant or a baby. So we call it eyeball pressure. So we imagine if you shut your eye and you took your finger onto your eyeball and you pushed your eyeball as much as you could comfortably, that is the pressure that we would use. That is the maximum pressure that we would use on a baby. So it's really important that you know that we're not doing any of our regular grown-up treatments on your baby. So that would be the number 1 thing people always say to me, and I'm like, no, it's very different how we work on babies compared to how we might sometimes work on adults. And we talk about the eyeball pressure. It's very unlikely that anything we do with your baby is causing your baby any pain or discomfort. Sometimes the babies will be annoyed because they know I'm a stranger, they're in a strange environment, and I'm poking and prodding them. Sometimes I have to look in their mouth to check for tongue tie or to do any intraoral work, which can help with breastfeeding and other issues. So sometimes we need to do that, and they generally don't like that because they think they're getting fed, and then of course it's not, it's just me having a look in their mouth. So that sometimes that might upset them, but I don't believe that anything that we're doing is painful or uncomfortable or in a distressing way for the baby. Okay, number 2, you do not have to book an appointment for the drop-in baby clinic. This freaks a lot of people out because they're used to booking appointments at our clinic, and for all the rest of you, yes, you do have to book an appointment, but if you are bringing a new baby in, you do not have to book an appointment. It is a drop-in. This means sometimes you might come in, and if there's 5 or 6 people in front of you, you will have a wait. That is inevitable. Sometimes you'll turn up and you're the first one in, so you won't have a wait at all. We just don't know. But that's kind of the beauty of the baby clinic. Sometimes you might have a wait and sometimes you might not, but we don't usually take any other patients during that time. So it's a nice relaxed family atmosphere. It's quite like a baby group where everybody gets a cup of tea and your babies just hang out and you can do whatever you need to do, and everybody's kind of in the same boat. So yeah, a lot of people say, oh, do I need to book? No, it's a drop-in. Just show up anytime between 10 and 12. If it's your first time, try and get there as early as possible because your first visit takes a little bit longer. Okay, number 3. We do have some limited research that actually backs up the sort of work that we do with babies. I think there are still some people out there who think that we are quite sort of out there, and it's a bit woo-woo and it doesn't really make sense. The way that we work is we are physically releasing tension in your baby's body. We're not waving magical sticks around. It's not about changing any energy or anything like that. That's not how we work. We are, as much as possible, an evidence-based practice. So there are some studies out there to suggest that chiropractic and osteopathy can help with breastfeeding, can help reduce the amount of hours that a baby cries, can help them more comfortably lie on their back, and we've seen it in the clinic. But what I absolutely cannot do is make any bold claims saying that chiropractic or osteopathy can cure any particular complaints with babies. You will just never ever hear me say that. But there are some limited studies out there. So if you do come to the baby clinic, it's very important, if we are currently being involved in any particular research studies, I ask you to be a part of that study. It's always anonymous, but we do need you to fill in some extra paperwork. And that is a commitment that I decided to make when I opened the baby clinic, that I would contribute to the research as much as possible. So if you do come to baby clinic, I will definitely be asking you to participate in the research, but it's always anonymous. So number 4 is, we like to think we can help as much as possible, but we don't claim to be able to know everything about everything. And we certainly love to work with other health professionals that we think could help you. So whether that is a qualified breastfeeding professional that you need to go and see, we usually have a breastfeeding counsellor on site with us. I'm a breastfeeding counsellor. I'm actually in training to become a lactation consultant, so I'm almost always there for baby clinic. We sometimes have an additional breastfeeding counsellor. We sometimes have another lactation consultant on site. We have in the past referred babies back to their GPs, back to their health visitors, out to speech and language therapists, out to pediatric physiotherapists. We also recommend that mums consider helmet therapy if there's a baby with a flat head that we feel is out with our realm of expertise. So it's important that you know that if we can't help you and your baby, then we'll find somebody who can, and we'll send you to that right person for you. Okay, so I hope that answers any questions. If you have any more questions, please get in touch or comment below. Our baby clinic runs on Tuesdays from 10 till 12, and it's a massively discounted rate to how much we normally charge for appointments for babies or adults. It's a huge discount, so we do that because I am very passionate about getting in touch with as many babies as possible. If you live further away, or if you're unable to leave your house for any reason, we do offer online video consultations with myself, and I can take you through step by step all the exercises and stretches that you can do safely with your baby to encourage optimum positioning and reducing tension in your baby, which might help with any particular issues that you're experiencing. So if you're interested with that, pop over to our website, which is banchoryspinalhealth.co.uk. One of the first buttons you'll see is book your online consultation, and I can talk you through all the stuff that you can do with your baby at home, which will help. Okay, thanks for listening, thanks for watching, and I will speak to you soon. Okay, bye.